Welcome to the general session for the 2022-2023 annual statewide training for the School-Based Access Program. My name is Jennifer Wigand, and I've been working with the program now for about 5 years, and in this role for 3. So welcome back, and thanks for sticking with me. We're going to cover a lot of ground today. If you take a look at the agenda, some of these things are topics we have discussed before, so we'll move quickly through those and spend hopefully the bulk of our time this morning addressing handbook updates that are very fresh. So, as we talk about program basics, as we do every year, want to just remind you of all the various folks who are involved in supporting this program, both within the Department of Human Services, the Pennsylvania Department of Education, you all, our local education agencies, and our contractors who support the work that you do and that we do within the department. So, returning again for our 2022-23 year, we've got PCG covering our Lot 1 services and SSG with our Lot 2 services that you can see there. That list hasn't changed for this year, so all those items should be familiar to you, and you'll hear more from each of them later today. Also wanted to remind you, continue to use this flowchart that helps you to take a look at the different ongoing activities of the program and how they affect the outcome for your individual LEA. So keeping always the activities of the direct service claims that you're submitting throughout the year, participating in the random moment time study, and working towards both those administrative reimbursements through your MAC claims, and then, of course, interim payments through the year, and ultimately your cost settlement. We've also included, again, this graphic that's also part of the handbook. Any of you who are new this year to participating in the School-Based Access Program, you want to pay attention to those blue boxes, especially. Those are key things that you want to take care of in order to get you started within the program. And then the rest of the flow chart just works through those different activities that each LEA is responsible for throughout the year. Also, another reminder, this is our recurring timeline. These are the deadlines and the time frames for a lot of those activities that you see in those flow charts ahead of this. So we did highlight a couple things in red this time around, just reminders in particular as we're getting ready to move into cost reporting season, that those cost reports will open on October 1st, and they have to be completed by the end of the year. So this timeline has already been posted to the school-based website, so you've got access to this information in a couple of different places. As always, we like to focus just a little bit on the quarter that we're preparing to go into, the October to December quarter. Key things you want to remember: get your request for an unrestricted indirect cost rate as you do your annual financial report. You know, you're going to be getting ready to certify cost pools again. You should be answering moments for the time study, and of course you're working on those cost reports. So it's an active time of year, and even when we know you're just getting settled back into a new school year. And hopefully for everybody, 22-23 will be a little bit more of a normal or a typical school year after the disruption that everybody has experienced over the last couple of years. So we do want to take a look at financial performance for the program. looking at 2020, 2021, again, that was a kind of a bumpy ride for schools. There were still a lot of changes within your schedules, being hybrid, in person, you know, so we understand that there were a lot of things affecting the activities of the schools in that time frame. So some of the positives with regard to school-based, you did continue to see a little bit higher reimbursement thanks to that enhanced FMAP. That will continue to apply within the program. As of now, the public health emergency has been extended through October 13th, excuse me, of 2022. So until that public health emergency has ended, you'll continue to see the enhanced FMAP. So as we look overall at performance and revenue, we did see a decrease in 2021. So when we cost settled and we looked at those final numbers, there certainly was a decrease from the prior year, from 180 million down to 166 million. So the expectation or the understanding really would be that there was less claiming during that time period because of that unsettled nature of the attendance at schools, the ability for services to be provided, and so there certainly was that impact in that school year. You know, I do expect a turnaround when we cost settle from 21-22, because I do think things kind of evened out. We got used to telemedicine, and hopefully we're going to see some trends moving back in positive directions for the program. So, you know, so again, when we look at this direct service claiming versus the cost settlement, so when did LEAs see most of their money and most of their reimbursement? You know, of course, as we're saying, because of the status of that 2021 year, we saw really low numbers in terms of those interim payments, direct service claiming, versus what was received during cost settlement. So what we're striving to get back to is where we were pre-pandemic, right? So when we do this again next year, I hope that we'll start to see these bars shift the way that they were previously, and that we get back to a more balanced perspective in terms of interim payments and cost settlements. So, and you know, so this is just a little more detail with regard to what we saw when we looked at the settlements, and certainly a lot of this can be attributed to the pandemic and the issues that we were facing during the pandemic, but ultimately there are still folks who are relying too much on just a few claims to get them through to cost settlement. And when we look at the examples that are here on this slide, these first two, that's claiming at less than 1% of your overall costs. And in this third example, we're still only at 1.6%. So, you know, we encourage all of you to increase as we're normalizing, again, what our school days look like, that you get back into those better claiming habits and that we see those numbers improve. These are reminders that we provided last year, and just included those again for ways that you can, within your own LEA, strive to improve your claiming levels, making sure that you're logging and billing consistently. You know, work on submitting the logs and services within a 30 to 60 day time window, so that you have time, if there's a compliance issue, if there's anything preventing that claim from being submitted for reimbursement, that you have time to address those changes. the exception reports that are offered by the vendor, make sure you take a look at those to see where your claiming errors might be. And as we all now know, you need emergency and contingency plans in the event that something you don't expect occurs that impacts your ability to keep up with the claiming submission and the other activities required as part of school-based. So reminders as well on that connection between direct service claiming and MAC. If for some reason you get to the end of the year and you have received $0 in interim payments, you'll lose your MAC, and that's not a situation that you want to find yourself in. The department has begun the process that each quarter that MAC claims are calculated, we review those against the current level of interim payments. So if you have submitted all your costs to receive a quarterly MAC claim, but you have received no interim payments, you will likely get a notification from DHS that informs you that if that doesn't turn around, you could lose those MAC dollars at the end of the year. So, and that's, you know, again, that's intended to make sure that your LEA is fully aware of where they are in terms of their participation in the program throughout the year, so that nothing is a surprise at the end of the year. So the unrestricted indirect cost rate, another one of our favorite topics, right? We've been hitting this one every year for a couple years now, so I'm not going to spend too much time. The main thing is to remember that this is requested as part of your AFR process with PDE. You do need to specifically request this rate, and if you don't, PDE won't calculate one, they won't certify one, and we won't have one to apply to your school-based reimbursement. One of the biggest areas of confusion over the years has been when rates are actually calculated and when they're applied. So we've included this chart both in our training and we've added it to the handbook. And this allows you to see, looking across, what year the data is that you're providing as part of your AFR, when that information is being submitted, and when the rate is being certified. Then, when do we use it, right? When is it getting used and applied? So, a lot of times what we see is we get to the end of cost settlement for 21-22, and somebody says, but I have a rate for 21-22, but we're on a different year, right? We're never cost settling in that same year. So hopefully this will help you to keep track of when you submitted the AFR, when you got the rate, and when DHS is actually going to apply that rate to your reimbursement within the program. Again, we've included the screenshot. This is from, excuse me, from the PDE system. So this is, when you see this, this is when you want to indicate that you're going to apply for a rate. The department does not have any ability to answer questions about your AFR or the status of your rate when it's in process. So we've provided the contact information here for PDE. So as far as how your rate is applied, Section 9.4 of the handbook will give you information there, but for any other questions, you're going to want to reach out to PDE. So one of the things that was very important for all of our LEAs in the last year or so was the ability to use telemedicine. So we've included some reminders within our information this year. So Initially, these services were allowed to be delivered via telemedicine just as part of the pandemic, as a way to address the sudden change in attendance status for our students. But with the May 2022 issue of the handbook, we did provide permanent guidance with regard to telemedicine in the school-based access program. Personal care and nursing services continue to be the exception to what can be provided via telemedicine. No services within those categories can be billed to the school-based access program if they are provided via telemedicine. That doesn't mean that if your LEA is using a nurse or using a PCA in some capacity that they stop logging that information. It's just not a reimbursable service for the school-based access program. We do remind you to take a look at the MA bulletin that was issued for all MA providers with guidance regarding the delivery of telemedicine services. So again, some additional reminders here as far as when audio only can be used for delivering services, the fact that telemedicine must be a two-way, real-time interactive experience between the provider and the beneficiary. And we get a lot of questions regarding whether or not a service is appropriate to be delivered via telemedicine. And it's the responsibility of those service providers to keep up with what his or her licensing body actually allows and what they consider to be an appropriate telemedicine service. So if you're a speech language pathologist, we're expecting you to get that information from ASHA, not from us. So that's just that reminder there. Included again these examples of telemedicine services, what they might look like in your notes and what is actually billable. So the main thing we want to get back to, for billing purposes, it's the time that was spent directly with the student that can be billed through to Medicaid. We still want you to continue to document all the services, whether or not you can bill for them. Obviously, you have obligations under IDEA and the things that are documented in the IEP for delivery to the student. So you want to continue to do those things regardless of whether you can get Medicaid reimbursement for those activities. And I referred to the medical assistance bulletin that was updated earlier this year. And one of the questions that came about from that was specific to this issue of consent. So one reminder is that when an MA bulletin is issued for all providers, our school-based providers are just a little bit different, and not everything is an exact fit. So we understand that consent isn't going to look the same in a school setting as it would for an individual with a one-on-one visit to a provider, going to a provider's office, or choosing to have that service delivered via telemedicine. So while the bulletin will indicate that consent is required at each visit, we understand that that's not practical or even possible within a school setting. Consent as it relates to the provision of services within the schools is occurring as part of the IEP process. So we expect that the consent that you obtain is part of that process. When that parent or guardian, the individual who's signing that IEP on behalf of the student, that if those services are going to be delivered in part or whole by telemedicine, that is part of what the parent guardian is approving at that time. And also want to call attention to the fact that this is not the same as the parental consent document that's being signed by parents. That one-time parental consent document has to do with billing. It has nothing to do with telemedicine. So I know that can be confusing as well. So we're going to move now into the changes with the most recent version of the handbook. So, and this is fresh off the presses. It was posted to our website, actually not on the 16th, but on the 15th of September, with guidance for this new school year. So, and Deb is going to touch on this more in her compliance session, but one of the updates that you saw in the mid-year update, or the spring update, had to do with credentialing for orientation and mobility specialists. So we're not going to spend a lot of time on that today in this session, since that'll be addressed by BPI. There were some fairly significant changes this year, so we want to make sure that that we spend a little time, and also that you all take the opportunity to go out, use this link and go to our website to take a look at the new handbook and all those changes that will be highlighted in yellow so that they stand out for you. So in terms of kind of the overview of updates, one of the questions we've received over the past few years is, why can't a physician assistant sign my med-auth? Well, guess what? Now they can. They will be able to order and prescribe many, though not all, service types. There were still some restrictions, unfortunately, that that we do have with regard to what services they're able to authorize, but it does expand the potentials for your LEAs in terms of who can review IEPs and sign those med-auth forms. We've spent a lot of time working with updates within the health-related purchase services section of the handbook, looking to better define and describe the different kinds of contracted costs. We've worked to add more details with regard to the kind of things that you're reporting for costs. And we've also provided some additional descriptions on the different kinds of reviews that you are subject to as an LEA that participates in the school-based access program. So we're going to just run through some of these. Some things will be quick, and then we'll spend a little more time on the issues around the contracted costs. For enrollment and revalidation, we just wanted to include that reminder in the handbook that we do still require a paper application for provider type 35, both initial enrollments and when you do your revalidation. We do encourage you, because of that, to make sure that you allow enough time, at least 60 to 90 days, 90 days is preferable, to allow enrollment to work through the process of your application. Also, if anything changes with your LEA, like an address or a name change, we've actually had a couple LEAs whose names changed. Please try to deal with those as they occur rather than wrapping them into a revalidation. That can cause some concerns and some issues with our enrollment department, because if you change your name and your address and all those kinds of things, they see you as a new entity. And if you have questions, please do reach out either through the resource account for enrollment or to the school-based resource account, and we'll help you through those processes. So again, the delivery method section within section 3 of the handbook, so this is where we touch on telemedicine and the provision of services via telemedicine. We've provided a link directly from the handbook out to that MA bulletin that gives you the information that's for all providers. And I already talked a little bit about the consent issue and how that's going to be different within school-based versus what's presented within the MA bulletin. And there's also originating site fees that are mentioned within that MA bulletin that are not applicable within school-based. So again, if you have questions about things within that bulletin that seem not to apply, or you're not sure how you or your LEA should handle it, please do reach out to our resource account. So we know that at this point we kind of hope that telemedicine is becoming more of you're more comfortable with it, you've gotten used to your routines with it, but we do know that there will still be questions. So we'll work through those as they arise. Also within Section 3, that change allowing physician assistants to order and prescribe services will appear in each of these subsections for Section 3. So each of these service types can now be ordered or prescribed by a physician assistant. As we move through, a couple changes in Section 4 of the handbook. The medical necessity and medical authorization piece in Section 4.2 was updated again to reflect that addition of physician assistants and their ability to order and refer services for school-based. And within Section 4.4, we included information here with regard to overlapping service minutes, and this came from reviews that our partners in BPI conducted. And while certainly in an instance of a service, for example, like the example here of a tube feed, it is appropriate for that record to contain everything that the nurse does within the amount of time that the student is receiving the tube feed. So there may be other activities going on, vitals checks, things like that. And it's appropriate to record those, but it's not something that is separately billable, right? So the student was there for 45 minutes for the tube feed, and that's the full amount of time that you're billing. You're not going to add on additional minutes for things that occurred within the same time frame. In the evaluation section, so you may remember that a year or so ago we changed the format of the section related to evaluations from a chart back to a text format. And this information regarding reevaluations and the date for the reevaluation was inadvertently omitted. So that has been put back into the handbook to eliminate any confusion over whether this is different for initial evaluations and reevaluations. The section on the ICD-10 codes has also been updated. And this really is just to reflect that it's been a while since we made that switch from ICD-9 to ICD-10, so we don't need to look at that as a crosswalk anymore. So we've talked a little bit about record keeping in some of our recent newsletters. And you'll hear some more about some of this from the compliance session during this training. Record retention requirements for the school-based access program may conflict with the standard practices for your LEA, but we just want you to be reminded that in order for you to retain reimbursement you've received, in the event that any kind of audit or review is performed, you want to make sure you're hanging on to those records. We also included some information about direct service claiming and timely filing. There's a lot of steps between when you log a service and when you successfully receive reimbursement for that service. And so the additional information that's been provided is really meant to just explain some of those steps, or better explain some of those steps so that it's clear for those of you doing the submission, why do I need to check all these different things, and what's the time frame for doing so. So this is going to take us to section 7.5 within the handbook related to health-related purchased services. Billing for costs in this category has caused consternation for a lot of LEAs over the years, and some of that is because these categories really weren't as clearly defined as they needed to be. And so that was our goal in making changes this year, was to provide more information and hopefully clarify what we're really looking at in these different types of health-related purchase services. So the first of those is tuition, and a memo did go out in June of this year to talk about exactly what is allowable for reporting of tuition. So in terms of what our handbook has said since 2015, what our state plan says and allows for, is that LEAs are able to report tuition that is paid to approved private schools, chartered schools for the deaf and blind, and licensed private academic institutions. So there is a set of entities that the program allows for reimbursement of some of those costs. Over time, the LEAs that have reported tuition have reported to a wide variety and a large number of entities, and that has included other LEAs. And that is not what we want to do within the confines of the school-based access program. So beginning with the cost settlement of 22-23, so starting this year, you will not be able to report tuition that is paid to entities that are eligible to participate in the school-based access program. So if you're paying tuition to another LEA, you will not be able to report that tuition. So you will, when you get into cost reporting a year from now, that drop-down list of who you're reporting for is going to be much shorter. And this is because there is no way to ensure that we don't have one LEA reporting tuition for this student while the LEA that student attends, and that LEA also participates in the school-based access program, isn't submitting direct service claims on behalf of that same student. And verification that that's not occurring, that we're not getting a double dipping kind of situation, the oversight and reporting on something like that would just be too onerous. And again, it's not something that is part of our current state plan. So we understand that this is probably not good news for some of you, but it is part of our effort to make sure that as a program we're compliant, and that we don't have to pull money back. We don't have to recoup monies that have been reimbursed inappropriately. Other information that we included with regard to tuition is looking at how you're reporting those costs and how you're documenting those costs. And we've often struggled with the fiscal years in terms of when the student attended versus when those costs were actually realized. And for cost settlement, We are working through the accrual-based accounting method, so we're concerned with the dates of service associated to that tuition, which would be the dates of attendance. So just something to keep in mind for the costs that you're reporting and the documentation that you provide when that's necessary, when it's requested. So then we want to talk a little bit about the other types of contracted costs. So we've updated to try to clarify the definition for contracted cost because we want to look at these costs as separate and unique from a contracted employee, right? So in this case, what we're looking at are costs that are paid to an entity that provides these services for you. They bill you for providing these services, but that individual provider is not participating in the random moment time study, right? So that physical therapist, occupational therapist is not on a staff pool list. Their costs cannot be reported in the salary benefits contracted cost area of the cost report. So in this instance, we're expecting that the student is receiving these physical therapy services. You, as the LEA, are receiving an invoice on a monthly basis for those services, and you're paying that invoice for the services. And so you will report those as a true contracted cost, and that will fit into a different area of the cost report. You will obviously not see that this year when you are reporting your costs for 21-22. It'll be something that you see in the system for next year, okay? And I expect that we will talk more about this and provide more detail and more training on what that looks like in the cost report as we approach next fall. So, another instance where you might see these contracted costs be reported in this way is that if you have a student who, you're paying tuition for the student to attend another institution, but their costs that are not included, they're not wrapped into the tuition, so you pay tuition, but you pay separate invoices. And so in this case, you'll be able to report those invoices separate from the tuition, which should ultimately result in a higher level of reimbursement for those costs because you're not looking at it, we won't be looking at it through the lens of the health-related tuition percentage. We won't be trying to remove educational costs because there aren't educational costs if it's an invoice for PCA services or occupational therapy services, whatever the case may be. We wanted to as well try to provide some specifics about what should the documentation for these costs look like? What should we be able to provide if we're selected for oversight and monitoring? Ideally, you've got the contract, you've got the invoices that were submitted to you, backup details that connect that invoice to the student. And that's why I really wanted to give you some examples, but unfortunately all the good examples of documentation like this, by the time I got done marking out the private information, there's nothing left to look at. But you're looking for this student received services on this date, this much time, with this therapist, right? And here's the summary. This is the amount that your LEA is going to have to pay. And we do see that from the various agencies that provide physical therapists, occupational therapists, to provide services in schools. So those are the kind of things that we are looking for to document those costs. So We also did a little bit of updating to the cost report section itself. So, you know, we do like to remind you that the cost report opens on October 1. I know you guys get tired of hearing it. I do. But we want to make sure you're aware of it. The process has started, especially if you are the one and only person in your LEA to complete this task. We know it takes time, and that's what those reminders are about. We also provided some more details with regard to allowable costs to hopefully clarify some of that information, and wanted to highlight the reminder that you're only reporting costs if the individual was on the staff pool list. So, and that's tied into what we just talked about in terms of contracted costs versus where you're getting just an invoice for services that were provided by an individual who is not on the staff pool list, versus if you have a therapist that your district hires on a contract basis, but your district requires them to participate in the time study. So hopefully providing some clarifications on those different kinds of costs that we actually see that the LEAs are incurring. And as we move on into the cost reconciliation settlement process, we created a separate section regarding desk reviews just to highlight how important that step is within the process. So most of you know, if you've been participating in the program for a while, you know that you have the opportunity to self-report to BPI if you think you've made a mistake with your claiming activities. But the desk review time frame is really your opportunity to kind of self-report or address any errors you think you may have made in the process of entering your cost. So even if even if your LEA doesn't receive a flag that tells you to look at something, that's a great time. That time frame is when you should be going in to double check, make sure that all the information has been entered in the correct place, that you didn't accidentally make a keying error that might affect the outcome of your settlement. So we also included some additional information related to the CPEs, and as that last step really for you in cost settlement. If no one signs the CPE so that it can be uploaded, then there's no way for your LEA to receive that final reimbursement for cost settlement. We also provided some additional information around the monitoring and compliance activities that are part of the school-based access program. We've provided a little bit more detail on oversight and monitoring reviews, looked at steps in the review process, time frame for providing the documentation, and also trying to give you just a little bit of an idea of what kind of documents you would want to provide as part of that review. We also added new information around the quality assurance reviews. And those reviews have been conducted for years. That's been an integral part of the program, but they just haven't really been mentioned within the handbook. And those are an opportunity for staff in your LEA to connect with the vendor, ask questions, provide examples of documentation to find out if they think it's appropriate, just to kind of make sure that you and your LEA are on track within the program so that you don't end up with surprises at the end of the year when it's too late to fix things. Within the section on MAC, on the administrative claiming, we mentioned this a little bit earlier, that the department will reach out if we note that your LEA has not received interim payments and, as a result, could be in jeopardy of losing those MAC payments at the end of the year if they don't, if you aren't able to get your direct claiming activities back on track. Some of the other sections that we'll talk about just a little bit, there were some minor changes, updating those citations to federal regulations. The IEP ratio, sometimes that is still a challenge for some of our LEAs, so we did some editing to try to clarify language. And we also included the diagram of that ratio that's been included in prior training presentations, just so that you've got that there for your reference, so you don't have to go back and forth between different documents to find that information. As I mentioned earlier, when we talked briefly about the unrestricted indirect cost rate, we did update this section to include that chart that shows you the process of the travel of the year of data, the year it's submitted, the year it's certified, and when and how it's applied. Within our chapter on financial data, we added some additional information with regard to staff benefits. There has been confusion that we've heard from LEAs during oversight and monitoring typically with regard to exactly what is part of that category of benefits and what should be reported somewhere else, or is perhaps not able to be reported as part of your cost report. We also, this time around, added a sample Cpe form. This may be helpful for those of you that are new participants. The Cpe form changed ever so slightly this year, putting lines in the correct format for the account codes that you need to provide when you complete that form. And we also wanted to call attention to, just reiterate that whoever is responsible for the final signature on this Cpe form should really be involved in your process before they see the Cpe form. They should have that opportunity to review the cost report and make sure that they are comfortable that that is in fact the correct amount or an appropriate amount when they sign that form. If if you've got someone who by the time they see the Cpe, if they haven't looked at anything else in the cost report, you're already at a stage where you really can't make a change prior to the actual cost settlement. So involve the folks who are responsible for signing. So I know that was a lot of information on the handbook, and some of it I may have covered in more detail than you wanted, and some not enough. But as always, we're here to answer questions as you have them. So a few other reminders that we wanted to include. Just a couple points on the medical provider authorization form. So you want to make sure that you've got an appropriate individual who is actually signing those forms. And again, this year you have more options. You've got that physician assistant option for some of your services. Make sure that that form is obtained at least annually. It needs to be concurrent with the IEP. So if something changes on the IEP, the med-auth has to change. I know the compliance speaks about this regularly. If the med-auth wasn't signed, then the service can't be billed. There is no backdating. There is no submission of services prior to the date on that form. Electronic signature became much more important during the pandemic, a lot more widely used. So just some reminders here, it is acceptable. Most districts have their own policies, so make sure that you are meeting the requirements as they're explained in the handbook, and that you're also compliant with your own district's policies. The group versus individual issue on the MedAuth became a bigger concern during the public health emergency as students who were receiving face-to-face services shifted to telemedicine, and oftentimes things that were services that were being provided in a group setting had to shift to individual as a result of telemedicine. Unfortunately, if the MedAuth is signed authorizing group services, that's what was determined to be medically necessary, and that's what is actually can be billed. So while the department doesn't set any requirements for the IEP, you may want to think about if there's a potential for some services to be delivered in person, and therefore in a group setting, some might be delivered via telemedicine and therefore be individual. Make sure that each of those is accounted for on the IEP and on the associated MedAuth. We brought this up last year, these Contractor Responsibility Program blocks. We saw lots of them in 2021. They've slowed down in 2022, but these are just some reminders of what to do if you see that you have one, because we are not able to resolve these for you. So you want to make sure that whoever your business or financial manager is, you know who they are, because they're going to be the ones to help you resolve these blocks. What we did see more of in the last year was actually missing or incorrect banking information when we do a MAC claim. So if you change your, who your LEA does their banking with, you need to make sure that those updates are made. Within the handbook, you've got links that will take you to the forms that you need to complete, but that slows down the process of moving those claims out for payment. So just do keep an eye on making sure you've got correct banking information. So we're going to wind out with just some resources so that you guys know who you need to reach out to, or how you need to reach out to get answers to your questions. So contact form, we can never say enough about how important it is to keep these up to date. But so it takes about 30 days to complete that update. We don't issue this on a weekly basis, we issue it on a monthly basis, but make sure that you get those forms updated and submitted so that the correct individuals within your LEA are receiving the information that they need. There are a number of places that you can find information about the School-Based Access Program. There's the DHS website, each of our vendor websites, and each of our vendors also provide webinars on a regular basis. So make sure that you are going out to those websites, finding out what's new. You can find important things with the cost reporting coming up. The list of supplies and materials is right there on SSG's website. You can take a look at that to help you determine what costs you can report. Any questions that you have for us, please make sure that they go to the resource account that is monitored daily, and we will move your email to the appropriate person to provide an answer. And we do certainly strive to answer those as quickly as we're able. So we'll give you our contractor information again. If you have questions that you know are specific to one of those contractors, you can reach out to their support desk directly. And we do appreciate your feedback, questions, comments that you might have based on this year's training. So please take a few minutes to go out and complete the survey. If you are viewing this presentation within about 5 days of the actual fall training date, then you should still be able to complete that survey. If you're viewing this and it's November, unfortunately, you'll have to send your feedback to us just through the resource account because the survey will be closed. So, but we appreciate your time today. Always appreciate your investment of time in learning more about the program, keeping up to date with changes, and working to make this a successful program. So thanks and have a great year.